How to identify an HIV rash on face. Hello folks, it's Mark Medicals with the latest on HIV cure news, HIV treatment, HIV symptoms, and HIV testing. This video covers the following questions, so sit tight and learn it all. 1. When does HIV rash start? 2. How long does HIV rash last? 3. What does HIV on the face look like? 4. Is HIV rash on face itchy? 5. What does HIV rash look like on black skin? 6. How do I know if my rash is HIV? 7. Where is HIV rash located? 8. Does HIV rash go away? Question: when does HIV rash start? Well, if you just got infected with HIV, there are what we call early HIV symptoms you will experience during the first 1 to 3 months after exposure. If you would like to know some of the common symptoms, these include a fever, skin rash, enlarged lymph nodes, cough, diarrhea, night sweats, fatigue, and others. Question: how long does HIV rash last? How long HIV rash lasts depends on so many factors like how strong your immunity is, HIV strain, the existence of other medical conditions, how fast the virus replicates, and so many others. Studies have shown that these early HIV symptoms last for up to 1 to 2 weeks and usually heal by self. What I need to tell you is that not every skin rash implies an HIV infection. There are so many non-HIV causes of HIV rash like allergies, drugs, and other systemic diseases. Question: what does HIV on the face look like? The rash normally manifests as a red, flattened region of skin that is typically covered in little red bumps, whether it is brought on by an HIV treatment or by HIV itself. Of course, not all rash on the face is due to an HIV infection. Question: is HIV rash on face itchy? The most typical HIV rash appears soon after infection. It is a flat, red region covered in tiny red bumps that typically develop on the abdomen, face, arms, or legs. If you recently had exposure and you develop a body rash a few days after, go for HIV testing. Question: what does HIV rash look like on black skin? A rash brought on by a fresh HIV infection typically appears on your face or body and is characterized by tiny pimples. On black skin, the region could seem purple. The color is typically crimson on white skin. Question: how do I know if my rash is HIV? You cannot detect HIV by physically looking at the person. You can only know if you have HIV or not by taking an HIV test. If you are wondering how soon you should test after exposure, the window period of HIV is from 10 days up to 90 days. Every HIV testing kit has a different window period, so speak to your doctor and help me choose the best timing for your HIV testing. Every person HIV positive or negative suffer from an HIV rash. You can only know if you have HIV rash or not, only if you test positive for HIV. You have HIV-related rash only if you tested HIV positive. Question: where is HIV rash located? The most typical HIV rash appears soon after infection. It is a flat, red region covered in tiny red bumps that typically develop on the abdomen, face, arms, or legs. This rash frequently appears as a slightly elevated skin region. Typically, it can be found on your hands, feet, trunk, or face. Red or more purple on those with darker skin tones. Question: does HIV rash go away? HIV-related rashes that develop during the acute stage of the disease usually fade away on their own in a few weeks. If they emerge as a result of taking specific medications or another disease, they can typically be treated, or your doctor may urge you to wait for them to go away naturally. HIV rash tends to disappear even without any medications. There is a difference between HIV-related rash and AIDS rash. AIDS sets in 5 to 15 years after HIV infection for people living with HIV and are not taking any medications. AIDS rash usually come and go. Hope you guys now know how to identify an HIV rash and how to tell HIV rash on face.